This month is all about the ankle. This week we're going to talk about extended hand to big toe pose and how to modify that for somebody who has a hard time standing on one leg. So we also want to remember that with the ankle, it's kind of a complex joint in that it has all of the tarsal bones of the foot. You know, we have the ankle bones, we have our calf muscles, we have our shin muscles, there's everters, so there's kind of a lot going on there. And if something is causing somebody pain, we don't want them to continue doing that. So it's good to know modifications. So instead of, say, we're coming into a standing variation, right, because I like to grab the outside of my foot. Here, this is more of our traditional or out to the side. So instead of doing that standing, because that's harder to modify, if someone can hold it for a shorter period of time, you can just have them bring their leg up like that. I've done that before where you have them grasp or come out, and then you're kind of omitting the lower portion. However, you're still standing on one leg. So we're going to talk about just taking a reclined approach. So we come onto our backs and we loop our strap around the ball of the foot. So we're going to bring this foot down. Now we're making sure, just like when we're standing, we're not letting this leg rotate medially or laterally. It's going straight down. So we pull the toes up just like we're standing. Again, we can put a block or something at the end so that foot has something to press on if that feels good. We might need to keep a bend in the knee. That's okay. That's better than bending it backwards. So we have the shoulders plugged into the floor. And we're just doing this reclined. We can go out, we can go in, we can even pull on one side of the strap if the ankle's a little tighter on one side, or shift the other way. So now I've pulled a little more on this one. See, it's inverting a little bit, or everting the other way. But if someone is recovering or has a really sensitive ankle, I would say just go straight, even pressure is going to be the best bet. So that's a pretty simple modification for a fairly challenging pose.